just tell me when you would like to take control.
Okay, I'll go ahead and take control. Let's see. Get that out of the way. Did it send you the request?
It did. There you
Okay.
go.
All right. Good morning, everyone. I'm Julie Lane. I'm Senior Manager of Complex Behavior. Hopefully, I have been in front of most of you by now at this point of the year. I am with Dr. April Ebinger today. She's our Director of Psychological and Behavioral Services for the department. And our wonderful Jamie Seek is under the weather today and not able to join us. So April and I are taking this one on, and we're going to talk about response to intervention, response to instruction and intervention in practice, supporting learning, language, and behavior without delay. April, there we go. All right, here's our reminder about AI tools. We do not allow the use of AI tools when we are presenting. We're going to record this and share this out as long as we can keep everyone muted and not have any questions during the presentation. We'll address those at the end. But if there are any AI tools in the chat, we will ask those folks to leave and re-enter without their AI tool. I'm having a little trouble getting it to click over. There we go. All right, here's our agenda for today. We're going to talk about defining response to instruction and intervention. And just a reminder that it's RTI squared. There's the two I's, instruction, which is that tier 1 instruction that all students participate in, and intervention. We're going to recognize the balance between evaluation and instruction, supporting students without delay, understanding specially designed instruction versus tiered interventions. We're going to look at some case law, and we're going to reference some frequently asked questions that we are receiving at the department. All right, I'm having trouble getting it to click again. All right, we're going to talk about defining what RTI squared is. RTI squared is Tennessee's framework, educational framework for all students. And again, we have the two I's as part of RTI squared: instruction, whole group instruction, and intervention. Learning has its foundation in access to high quality instruction with appropriate scaffolds throughout the school day. There's an emphasis on intervening with students when they first start to struggle to avoid prolonged academic or behavioral difficulties. So when we begin to see those difficulties for students, we don't want to delay in an effort to see if intervention works. We want to address those early on. This quote here comes directly from our RTI manual that was refined in 2023. The RTI framework provides intentional supports to set all students on a path to success, help educators understand where students are, and through a continuum of supports, assist them in moving forward. We've got some foundational principles of RTI squared. It's a multi-tiered system available for all students, meaning it is universal and available for all students. Tier 1 is our high-quality core instruction for all students. Tier 2 is targeted learning acceleration supports for some students. And Tier 3 is intensive skills-based intervention for few students. We always want to make sure that we are using data analysis to inform our decisions. And with that, we use those to determine if and when students need additional instruction through intervention supports along the 3 tiers, understanding that there are multiple entry and exit points along the tiers. Oh, sorry, we clicked forward too soon. April, are you moving it to? We've gotten... Someone is clicking through, but it's not us.
Hey, Julie, let me just take control back.
Okay.
And
Okay.
Okay.
We're in the foundational principles of RTI.
Goodness
Here we
gracious.
go.
There we
Yes.
go. Okay.
All right, so using our data to inform our decisions on when students need the intervention, and that reminding you guys that there are multiple entry and exit points along the tiers. So there's no more we are in tier 1 and then we are in tier 2 for this amount of time before we can go to tier 3. There's not gates on any of these tiers that require a student to be in one tier for any certain amount of time before they go to another tier. For effective implementation of RTI squared, there needs to be effective assessment, data-based decision-making, and instruction and intervention all working together for students. April, I'm ready for them. Okay, it's not just me. All right, and so again, just focusing on that assessment piece and that's used to make our data-based decisions. We're looking at universal screening, we're looking at progress monitoring data, we're looking at things that teachers are bringing to the table to show us work-based classroom samples. All of that information is used to make our data-based decisions on tiered instruction for our students. All right, I like to call this the RTI Circle of Life, but starting with a reminder that we don't want this to become a hamster wheel that we are always in and never making any changes. So we're going to start with defining what are the students' area or areas of need. We're going to look at a variety of data to understand student performance in comparison to what we are expecting. I'm going to identify that area of need. Then we're going to analyze, we're going to gather and examine student data to create a comprehensive profile of student performance. We're going to look at their strengths and their needs. We're going to create a plan and we're going to implement that plan. We're going to make sure that we are following our plan for intervention. And then we're going to evaluate. When we looked at our defining the area of need and we analyzed and we implemented a plan, we're going to evaluate, did that work? And if it didn't work and we're not seeing the progress that we would expect, we're going to look at that definition of need, what that area of need is again. We're going to analyze further. But again, it's that circle of RTI life, but let's not get stuck in the hamster wheel going around and around and around without looking at our child find obligations.
Julie, this is Haley.
Yes.
Do you mind if
Hey,
I jump
Haley.
in for just a moment?
Yes,
Good
please.
morning, everyone. Sorry to just intrude. Haley
No, you are the
Richardson,
guru, please.
Senior Manager of Intervention here at the department. Happy to join you all this morning. Julie, you did a beautiful job describing this. I do just want to point out one little thing here. Yes, as Julie said, you don't want to get caught in the hamster wheel of kind of this circular thinking around responding. What it means to respond means that we are going to look at the data that we have gathered, that variety of data, and interpret it to understand a student's performance in response to the instruction that they have been provided within that intervention. If a student has not responded, we're going to ask questions to determine why not. If a student has responded, we want to understand what we did within that intervention that produced that response and where we need to go next. And then if we don't know if it was successful or not, if we have a questionable response, we want to refine what we're doing within those spaces. So that could be looking to see, did we define the need accurately? It could be asking the question, did we truly align the instruction provided within the intervention to the defined need? So making sure that we're asking that variety of questions as we are engaging in this decision-making space is really going to get us to outcomes for students that move the needle on filling in those needs.
Thank you, Haley.
Thank you,
Anytime you
Julie.
want to jump in, please do so. All right, special education and RTI squared. Special education is not the fourth tier of RTI. In the RTI squared framework, student progress is regularly monitored and analyzed, and data-based decisions regarding appropriate interventions are determined and delivered with fidelity. Should a student not show growth in response to intervention at any point, the school team may want to ask these questions. Why is the student not showing growth? Does the intervention need to change? Are the assessment tools that we're using accurately informing the team? Is there evidence to suspect a disability, such that a child must be referred for special education? So we're kind of referencing back to what Haley just talked about. We want to ask our team these questions when we are evaluating our tiered interventions and student progress. All right, reminders also. Students are not required to exhaust all tiers of intervention. So we're not saying the student has to be in tier 2 for this amount of time and then has to be in tier 3 for this amount of time. A student can go from tier 1 to tier 3. So again, not required to go through all tiers of intervention. We're not required to obtain a specific number of progress monitoring data points or receive a certain number of weeks in intervention. That's not written in state board rule, that's not written in IDEA. So we just want to make sure that we're not saying that we have to have this many weeks or this many data points before we can look at an evaluation. RTI is not to be solely based on assessment score cutoffs, and a student can be referred anytime a disability is suspected. April, I think this is where you begin.
My computer is not working with me. And I think, Julie, you still have control. So I don't know if there's a way that you can say, I don't want control any longer. That would be fantastic.
Just stop.
So
hopefully.
Perfect. We do want to acknowledge that there's a balance here, right? So as Julie mentioned, not getting caught in that hamster wheel of going back to the beginning of your RTI process over and over and over again. You're going to see a few pieces of case law here in a moment that really will caution you on that process and procedure. But acknowledging that there is a balance to good instruction, good intervention, and then also knowing that all of that data that you're collecting through that process is going to guide your teams to understand when and to what extent you're going to request or make that referral for special education. We know that this letter to OSEP way back in 2011 essentially said that RTI cannot be used as a mechanism to delay or deny an evaluation. So we know that our state relies on response to intervention for our eligibility determinations for our specific learning disability students. We also know that interventions are required under our emotional disturbance category. So utilizing that RTI A and B for many of our eligibility categories is not an option. We know that we have to engage with our general education teams to collect the data that is required. We know that that process is going to maybe look a little bit differently depending on when and how a child is referred. But it is our obligation to ensure that we're not delaying or denying when we do suspect a disability. We're not letting the process come in place of serving that child and ensuring that that child has what he or she needs. So when we think about some of this misconceptions around acknowledging that there is a balance to this, right? We hear quite often still that parents are being told that they must go through certain number of weeks in an intervention. They must have this before we can do this. They must be scoring below this percentile or cut score, folks. All of that goes in direct conflict with state and federal law. We serve our students. We do not serve specific cut scores or specific processes in terms of weeks in intervention. So we also need to acknowledge, and this is where we're going to lean into some of our speech language pathologists who are on this call, is we need to really understand and educate our teachers and our interventionists around what is developmentally appropriate in light and in context of grade level standards-based instruction, right? We also know that there are some developmental milestones that are not necessarily reached until certain ages. And that is where us as assessment specialists can really lean into equipping our educators across our school buildings to know what should be a red flag or a red flag to that immediate referral for special education, or is maybe a yellow flag to say, hey, we're concerned, but what can we do at that general education level within our RTI structure to serve and remediate some of these deficits that we're acknowledging? We also need to ensure that we have consistent and updated referral practices. I know Julie and I spend a lot of time with our federal programs and operations teams. We review district level policies and procedures. And folks, I can't tell you, um, uh, just recently we were reviewing policies and procedures and they referenced Easy IEP. We haven't had Easy IEP for several years now. And what that tells me is that we're not looping back to our policies and procedures annually to ensure that they are reflective of what we're actually doing in our school buildings. We need to ensure that those policies and procedures are updated and they're accurate, and that we have mechanisms within our procedures to know, does your educator know that if they suspect a disability on day one of school, what that process is? Do they know what to do? Or are they scrambling, or are they being told to wait, 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 wait? In terms of, we need to be responsive to what our status is for our students. I was on a call recently and I was consulting with a school district, and they said, well, we have a policy that we do not refer for evaluation, refer for RTI if they're in kindergarten until the spring semester. Ooh, I bet all of you could hear some procedural issues with that. We cannot treat all of our kids as one. We have to individualize those decisions. And often that means we're going to approach them on a case-by-case basis. Doesn't mean that we're not going to be able to implement intervention for those students in kindergarten. It just means that if we have an issue or a concern that does need to go through that evaluative process earlier, that's what we're going to do. We're going to respond to the concerns, the data that we have for our students, and then we're going to ensure that those referral practices are present in our district policies and procedures. We also know that we have staffing concerns. We know that there are shortages across our assessment specialists, OTs, PTs, SLPs, school psychologists across the state. We know that this is a concern. That concern does not negate our obligation under state and federal law to pursue an evaluation when a disability is suspected. So what is your district doing to identify mechanisms and areas where we can leverage our faculty and staff in a way that is meaningful, but also that is in light of knowing that we're balancing that delaying or denying, that we're not delaying or denying based on the RTI processes themselves. I wrote this in here because I think this is really important, and I'm looping back to that first bullet, but normalizing developmental appropriateness. How many of you on this call, within the first week of school, you get a phone call from either the preschool teacher or the kindergarten teacher, and what you're hearing is all developmentally appropriate for a child, perhaps who has not been exposed to any type of structured educational setting before? Maybe we know that they haven't had any type of early intervention, and they're struggling with maybe behaviors that would be considered developmentally appropriate, or maybe they're not where the other peers in that classroom are. And I think we need to get back to a place where our expectations for our students are in light of what's developmentally appropriate and are leaning into what our standards are asking them to do. And I know that our teachers always have the best intent. They always are looking out for the best of their students. But I think sometimes when teachers don't also understand what is or is not developmentally appropriate, whether that is speech language sounds, right? Speech language progress, whether that is developmentally appropriateness for learning how to read and mastering identifying letters and sounds, or that's behavior or adaptive skills. Those developmentally appropriate skills, let's normalize what is and what should be, and then also equip them to say, wait, this isn't developmentally appropriate. Now we need to follow our processes and those pre-referral processes to ensure that we're notifying the right people. We're getting these students to help that they need in that real time. We're not waiting until we get that winter benchmark screener to flag our RTI team, we're really following what those processes dictate. And then I think too, ultimately, and I know Jamie Seek, who wasn't able to be here today, really, we have had a lot of strong conversations around speech language and a lack of knowledge of our general education teachers, our interventionists, on how to support students through that tiered intervention process around articulation, oral language. And what that means. And this is another space where I think as assessment specialists, we can really push in and help equip our general education teachers to do a lot of the work for us, but then giving them strategies and skills that they too can implement in their classrooms. That's really a best for all strategy, right? This is not just good for one, this is good for all. And I think that this is where us as assessment specialists can really lean into that consultative piece where we're showing and equipping our general education teachers to take the helm and implement a lot of these academic or behavioral interventions for us. I think too, we're going to talk a little bit more about this and really the legal responsibility that we have around accurate data collection. I think a lot of the case law that we're going to show you in the next few slides is going to startle you, because where districts err is they make decisions or determine to not make a decision without the data to support. But we also have to acknowledge, going back to that circle of life that Julie called it, right? That data should drive each and every decision bucket on that circle. And without data, we're guessing and hypothesizing. And our objective within RTI is to utilize all of the rich data that we have at our fingertips to then make a next best guess, really, about what that child needs in real time. But it should be data driven. And when we have inconsistent or inaccurate data, we then make decisions based on hopes, feelings, and wishes and dreams. And we need to take a step back often and say, do we have the right data to make this decision? And often what we see, especially through the specific learning disability lens, is we have the tool or the progress monitoring that we've been given, and it doesn't always align to the specific needs of those students. And so what other additional pieces of data can we implement and ask our interventionists and our teachers to collect for us that's really going to help to drive that decision-making process? Remember that, and I didn't include some of my slides that maybe I should have here, but progress monitoring is just one piece of data that we should be considering through that circle of life framework. We should be collecting other pieces of data that help support and drive those decisions that we're making, whether that's through work samples, end of course unit exams, grade level formative assessments. What else are we considering and looking at when we're making and using the circle of life process, I guess we're going to call it today. So again, finding that balance, we're going to ensure that we're not delaying, denying, knowing that we can do both concurrently is going to always be in your best interest, right? And we're going to ensure that students have time to benefit from Tier 1 instruction, but we also know that there are going to be those exceptions where students are going to have to be referred in a timely manner, even though they may be in their first week of school, okay? We are not going to allow the process to essentially delay or deny those evaluations when we suspect a disability, okay? Recognizing again that this is individualized and that it should be based on multiple pieces of data. How many of you have had teachers stop you in the hallway and say, well, I just know something's off, or I just know that there's a processing issue? Until the data shows me something is amiss, you're just using hopes, feelings, thoughts, dreams, right? We need data to help support that suspicion of a referral. And I know many of you in this room are so well versed in disability. Sometimes a student can walk into the room and you're like, oh, I know what's going on. but ultimately we must have data to support that referral and what we suspect. And if a teacher stops you, then push it back onto the teacher. And I hope your referral processes require this. The teacher then, if they're making that referral, should be able to bring the data of why they suspect that disability, either to your support team process or to your meeting where you're considering if initial consent is warranted. But really ensuring that you have the data at hand that you're going to review as a team when you're making that justification to assess or to not assess. So let's look at a few pieces of information here. When we think about supporting students, a big piece of this is ensuring that not only are we documenting the data that we're collecting, but we're sharing the progress or lack thereof. We know that our requirements around RTI are that we share those progress reports with parents at least every 4.5 weeks. And that is the expectation, especially if they're going through any type of IDA level evaluation. But look at these two cases. One is out of Alabama, the progress in a first grader with reading and attentional difficulties made when he received classroom level intervention supported a district's decision to delay his IDA referral. Let me expand on what this case said. This child was making progress in his tiered intervention, and they documented that he was making progress and ensured that the parent was notified. Well, the parent made a request for an evaluation and then turned around and filed due process claiming that the district violated child fine because they didn't initiate the evaluation earlier. They said, or the parents, claimed that they should have had knowledge that the child had a disability because the child was in these level of interventions, both with attentional and reading difficulties. And here's where the district did a great job. They intervened not just in the reading area, they were also doing that RTI, what we call RTI B, and they were intervening with some executive functioning interventions. And they were collecting good data and sharing that with the parent. So when the parent made a request for an evaluation in the middle of this, they said, no, this child is making progress. This shows us that tier 1 interventions work, right? That general education interventions work. And we don't suspect a disability because we're making progress. But folks, I don't think that the district would have prevailed in this case if they had not been collecting the right data and sharing those data consistently with the families. And so this goes to show if we're just sending home that progress monitoring, the printout from AimsWeb, is that enough? And it could be for many. But if a student has been in tiered intervention for quite a while, we need to justify why we're not moving to an evaluation, right? If the child is not making documented progress, but if they are, that's really important for us to note, okay? This other case here, because a student was making progress with reading interventions, a district did not err in waiting until the student's 4th grade year to evaluate her need for special education. This case read almost exactly like the first case did, even though the child was a 4th grader. So it really leans into, are we documenting progress? Are we collecting data? And these cases for me, I know we're talking a lot about reading interventions, but this is any intervention that we're doing, anything that's above and beyond tier 1 supports. Are we documenting how the child is making progress with those behavioral interventions? Are we documenting how that child's making progress with executive functioning interventions? And are we communicating back to parents? I'm going to stop right there. I see Dr. Danny put a response in the chat. Dr. Richardson, Dr. Danny, before I go on, any thoughts here to add or responses to questions in the chat?
So we just had some questions talking about percentile rank and different aspects of scores. And I just put in a contextualizing what we talk about when we talk about percentiles and how that is just one form of data output for a particular score. So it's important to remember that those are comparative metrics and not always necessarily proficiency metrics, in the sense of it's telling you how they performed on that task compared to their peers. And yes, you can use that as a guideline for risk, but you may also want to be looking at those scaled scores, looking at that raw scores, and thinking about the skill itself and what is grade appropriate or developmentally appropriate for that student to be at that point in the year, and then consider using those scores in your trend analysis and things like that to drive whether the student is making progress. And I think there was I assume, Patty, you were talking about fluency, but looking at accuracy versus percentile. That percentile is typically going to come from the rate side of fluency, whereas accuracy is going to be how many errors, how accurate they were in the sense of percentage of words they read correctly rather than words they read correctly in the minute. And both of those would be important, but they're different sides of fluency that are going to support each other. So I think it's just important to be thinking about all parts of the data that we're collecting when we're looking at what we have in front of us. So,
and I see a follow-up question that Patty has too that I think is fantastic. And this is what we hear a lot is what happens when a student has perhaps a higher cognitive profile. They're able to essentially access higher level skills, which are then masking lower level skills. Dr. Danny, do you want to speak to that quickly? And I can speak to it on the maybe non-reading side of things.
Yeah, I mean, I think that you do have students who, when we talk about, I'm going to come from the dyslexia lens here, may have compensatory skills, meaning they have perhaps really rich vocabulary, really good comprehension. So they're able to self-correct errors on words that maybe they would not have been able to read in isolation or things like that. I think that's where it's important to make sure that we're using a variety of data to flag any concerns that we have and then drilling down appropriately into those areas as needed. So, they may not flag super with concern on, let's say, a fluency probe because they're compensating through self-correction, but that rate is likely to be slower if they're self-correcting a bunch, even if their accuracy is still high. So if you have other data, there may be a reason to say, you know what, I'm still going to drill down and look at their word reading skills through a phonics inventory, look at their word reading skills through these other places. So I think it's just really taking those flags, even if they're minor, and just following the trail enough to confirm or deny your suspicion. I know we're not talking about deny and delay, but if you have a question about their word reading skill and you drill down and it's actually, turns out that phonics inventory, they're doing fine on decoding and identifying words in isolation, perhaps then your concern is misplaced and you need to look at other areas if they continue to struggle. But I think just really being attentive to where those flags come out and understanding that some students, yes, are going to perform well on some testing measures despite having deficits in certain skill areas. So that's why that variety of data is so important and not just looking at one data point or one data source.
I'm going to take a step back and just repeat what I heard that I think is the most powerful piece of what Dr. Dainty just said. Is if we're just taking the progress monitoring sheet that we're given from our data team and we're making decisions on that alone, we've already missed the mark, right? We have got to ensure that we truly understand the student's reading profile, math profile, language profile, behavioral profile, to an extent that if we picked up and had to write an IEP goal, we know what we can do with that. And all of us on this call, the majority of us are not writing fluency IEP goals. We have to be able to drill down, and that is by doing those item analyses on those progress monitoring probes as necessary to see if we identify any trends. And then if not, dig deeper, administering additional measures as warranted. But we cannot truly understand where a child's strengths and weaknesses are without being able to truly say, this is the symptom, this is what is flagging for us, but the underlying cause of those symptoms is this. And that is our obligation as assessment specialists through that evaluation process. Now, I hope through that RTI process that your RTI teams, if you're guiding those RTI teams, are doing similar processes, right? That would be the goal, because that's where I think the bread and butter of RTI comes, is if we're having these conversations and asking these questions in our data team meetings, now we're going to start to see our interventionists and our students in our tiered approaches moving the marker. But until we start having those conversations, and if we're just continuing to rely on whether they're performing at the 15th percentile, what does that mean for that student? And why aren't they able to make progress on this specific probe, especially knowing that the majority of us are using fluency probes? That alone, and many of you have heard this, is a symptom of something else. And as Dr. Danking just mentioned, whether that's through accuracy or word level decoding, whatever that is, our obligation is to dig deeper, to figure that out, to then support the child through that intervention process to ensure that all of those things are calculated to be connected. And if we're intervening on the wrong thing or we're collecting the wrong data, folks, how do we get to an eligibility determination? And really, are we able to stand on our data with confidence if we don't have what we need on the front end? And this is all about us collaborating with those general education teams to ensure that we have a role at the table. We're not in charge of those pieces, but have a role at least to be able to ask some good questions on the front end around those processes and procedures. Excellent discussion. Dr. Richardson, I see you unmuted. Go ahead.
Yeah, I see this question has popped up in the chat again, and I think April, you did, or Dr. Ebbinger, I think you did a beautiful job of answering that. I just would like to caution us all about using percentile scores alone as a point of decision making, and really lean into what Dr. Ebbinger just clarified, in that it's a robust conversation rooted in a variety of data that should be driving our ultimate decisions for students. And really acknowledging, yes, what the data is telling us, but also really diving into those data to understand what do they represent. So when we see the 25th percentile, what does that represent in terms of student performance across a variety of settings and spaces and assessments?
And I think all of us will agree, all of us on this call, for the most part, are assessment specialists. We have been trained in data analysis. We know how to quickly, clearly explain percentiles, standard scores, quartiles, all the things to our teams. But I think percentiles are sometimes easier for our faculty and staff to understand, and that's where we leaned into. But we have to go back to, especially perhaps those raw scores, digging into those item analyses in order to help train and teach our teams how to approach these individualized cases in a manner that is, in my opinion, the most ethical way to do that. And I think a big question that we always want to come back and say is when somebody calls me and says, April, we want to use the 25th percentile as the cutoff for RTI Tier 3. My first question typically back to them is, tell me the difference in a student who performs at the 25th percentile and a student who performs at the 26th percentile. What are the things that you will see or collect in your classroom that show me that those two students are markedly different? And often you can't tell me that. And that tells me that if we're going to use one cutoff score, again, we're not utilizing multiple sources of data, but we really don't understand the strengths and weaknesses of those students. And we're, again, utilizing one piece of data goes in direct conflict with federal law. We're going to use multiple sources of data, not only to enroll them into the RTI system, but then also to track their progress, and then to show either that they're not making progress, and then you're able to really justify when you do make that referral as an LEA to evaluate for any disability under IDEA. Julie, I see you unmuted. Any?
No, I'm just ready. The next ones are
Oh,
mine.
you're ready. The next. Oh, I'm sorry. I'm off track. Okay.
All right, so we're going to talk about a case having to do with supporting students without delay, and then some suggestions. This case is out of Connecticut. A second grade student was experiencing reading difficulties and was significantly below grade level. The LEA implemented intervention strategies. The parents produced an outside evaluation indicating a reading disability and anxiety associated with their reading difficulty. The LEA did not initiate an evaluation, but continued to implement intervention strategies despite progress reports and report cards indicating the student was not making progress. Data from tiered intervention indicated an increased level of tiered support. So they did increase their level of tiered support, but they did not initiate an evaluation for a suspected disability. So what do you guys think happened here? We'll go to the next slide and discuss what the outcome was. So what do you think the court said about this case? Did the LEA or the parent prevail? What would you have done in this situation? So those are all things to think about. But I think ultimately you guys know that the LEA violated its child find obligations and denied FAPE to the child. They were required, the LEA was required to reimburse the parent for private school placement. And so I just want to give you guys a reminder, when parents present us with an outside evaluation, we have to consider that. We consider that evaluation and what data we have to either support or deny an evaluation, and we issue that prior written notice. Proposing to complete an evaluation or denying the parent's request for an evaluation. But we can't just let that, that information that parents give us in the form of an outside evaluation to just linger and not do anything about it. So just a reminder there, that's very important. When parents participate and provide us with information, we want to consider that and then issue our notice through the prior written notice. All right, I think I have one more here. So some suggestions on providing support without delay. Again, there's no strict timelines or required number of data points around tiered intervention supports. Complete tiered supports concurrent with an evaluation. So there's nothing that prohibits you from conducting your evaluation at the same time the student is in tiered intervention supports. Allow student-driven data-based decisions to inform next steps. Like April says, don't let our hopes and dreams and wishes and wants be what is driving our decision-making. Communicate clearly with parents or guardians. Parents just want to know what's going on with their child. They want to have updates. And I think when they feel like they aren't getting information, they feel like they are left out and are likely to be upset. So communicate with parents, provide them with progress monitoring updates. Recognize indicators that would mark the need for either to wait or to initiate an evaluation for a suspected disability. So just, again, I know I've said it 15 to 20 times. April has said it, Haley and Jessica have said it. Data-based decision-making. Make sure that we have data to support our decisions, and then it's not just one number or one percentile or one score that we are using to make our decisions.
I see a question or a conversation in the chat that I just want to push in on. So when we think about our standards and we think about the data that we're collecting and looking at completing that, rate of improvement in that gap analysis, if we come to the table and a child is making really good progress, but they're not able to close the gap, does that alone mean they have a disability? No, we have got to collect additional information. What does all the other information that you collected say? If you're doing a one or more achievement level tests, what does that data show? What is the teacher input? What does the work sample analyses look like? What are your observations telling you? How is the student performing an intervention in the general education classroom? All of that should triangulate, and not one piece of data should rule over the rest. Oftentimes I'll get conversations where people will say, well, April, I only rely on the achievement test. Well, what happens if the kid had a bad day? Or if that achievement test wasn't actually digging into the true areas of need by this child and it missed the mark completely? We really need to use and collect multiple sources of data when we're thinking about, especially eligibility determinations. But if something doesn't align, if something doesn't jive, like your achievement test is showing that the child is performing all in the, average, low average range, and then your progress monitoring data is showing that the child's not making progress, something is amiss, folks. Either the intervention is not targeting the specific skill deficit, or the progress monitoring is not actually measuring what you want it to measure. These are questions we should be asking, but we shouldn't be proposing this to our team at the eligibility meeting saying, well, they're making progress, but the gap says that they're still way far behind grade level standards. By the way, just in this one area, right? Because when we're talking about grade level standards and access to that, your gap is only looking at what the progress monitoring probe measured. We're actually not aligning that back to grade level standards and their lack of ability to achieve those. We're just looking at progress monitoring data. That doesn't tell us much, folks. We have got to dig deeper. We have got to collect more information. And if we get to that eligibility meeting and we're saying this doesn't really quite measure up with this, and then you don't have anything else to help drive the decisions your team's making, oh my, that's our role as assessment specialists, is to come to the table with all of the data that your teams need to consider in order to determine eligibility. Okay. Feel free, Dr. Daney, Dr. Richardson, Julie, chime in here. Oops. Oh, I'm on number 22. Okay, timelines. We talked about this a lot. We want to ensure that our policies and procedures in our district are not reflective of procedural violations. We're not going to have within our policies and procedures that they have to be enrolled in tiered intervention. We saw this recently. We're not going to say that a school psychologist has to approve them to go into the tiers. We're not going to say a school psychologist has to approve an evaluation. We're not going to say that either. We're not going to write in that there's a certain number of weeks or that we have to have at least this number of data points, folks. 2022 was our resolution agreement with that due process for our RTI practices, and we're still trying to unlearn a lot of those things across the state. So please keep in mind, anytime that you're seeing these are not, this is not guidance. This is procedural violations if we see this in your policies procedures, or if you put this in your prior written notice, or if a parent calls us and says, hey, I requested an evaluation and they told me that this has to happen first. None of that is grounded in state or federal law. Okay. You'll notice too, I thought this case was interesting because how many of us are, and as we approach March and April coming into 2026, how many of us have ever said, well, you have to submit a referral by this date or we can't consider it until next school year? We've seen a little bit of this, and I thought that this case was really interesting because essentially this complaint that came out of Alaska, they had the same policies. They had a deadline for the referrals for students to be considered for initial evaluations. They had to be enrolled in RTI by this date to be considered for an SLD evaluation, folks. The school district in this case did not prevail. And what I would always encourage you to is maybe these are not explicitly written into your policies and procedures, but they're unspoken policies and procedures. That too is a procedural violation. We are going, child find is $365. Even though we're on summer break, even though we're on Christmas break, child find is $365, and we must accept those referrals as they come in and respond to them in an appropriate manner. So we know, I think we really have belabored the point here. Here's what I want to go back and think through those cases where a child's been in RTI for a long time. There is no specific exit ramp from RTI, right? There isn't a time frame to say, okay, they've been in RTI for 6 months. It all should be on an individualized basis. But what we do want to do is ensure that they're not living in that hamster wheel of, well, they're in first grade, they're in tier 2. Then in second grade, we put them into tier 3. Well, they get to third grade, and we know that's a very important year in our state. And well, we just need more time to make sure that we really suspect a disability, because we have this different interventionist, and she thinks she's going to be able to do and move this child better than the last interventionist. And well, now they're in grade 3, we have this different probe that we can use. So we want to collect this. I hope as I'm saying all of this, you hear procedural violation after procedural violation. We're not going to wait. We're not going to delay or deny. If we suspect, we're going to evaluate. Okay. Again, all of the data that we're gleaning from that tiered intervention is so valuable. If you've ever attended any of our trainings around specific learning disability, and I know that Jamie Seek feels the same way about speech language evaluations, I hope we're talking to our interventionists. I hope we're interviewing them. I hope when we're doing our observations, we're asking good questions. When we get to another slide with a case study in just a moment, I'm going to quiz you on, do you know your grade level standards? Do you know what they mean? Do you know what the acronyms mean? Because I would posit, and me I was a previous secondary English teacher. So when I was, entered the world of school psychology, I didn't really have a good grasp on elementary grade level standards. I knew my secondary standards, but I didn't have a good understanding of those. Folks, how can we say that students are not making adequate progress to achieve grade level standards if we don't know what they are? And if we don't know what they are in context of what we're asking students to do when we're observing during their reading or math or written expression or writing instruction, if we don't know what those are, then how are we measuring them that they can or will not achieve those grade level standards? Okay, we're going to talk a little bit more about that in just a moment when we get to this slide, but let's keep going. We know that we're going to make database decisions. We're going to ensure that we have the correct data that's being collected, that's being analyzed, and we're using, again, those multiple sources of data, as you can see here, when we're looking at variety of sources of information. This case, back in 2022, the LEA was found to be lacking critical data around the effectiveness of Tier 1 and 2 interventions for students. So this is where, again, it highlights the critical nature of collecting the right data, communicating that to parents, and ensuring that if the student isn't making progress, we're doing something about it. We're not just sitting on the hill of RTI saying, well, we hope it's going to work next time. We're doing something about that, whether that means we come back to our data team and we have a good conversation about looping back to that circle of life to say, did we define this problem appropriately? Did we have the right data when we're analyzing it? Did the intervention actually match our area of concern? Did we do what we needed to do? And I want to say this too, because one of the questions before, I think we phrased this wrong. RTI is about serving students right where they are and giving them the just-in-time supports, right? I think RTI is just good instruction, right? It's what we are supposed to do for any of our students that are not making the same gains that we wish them to do. But is this a student issue or is this an instructional issue? And often through our evaluation, we want to spotlight from a deficit-based approach to say what the child can't do. But really, often within the RTI framework, it's an instructional issue. And we are not the instructional experts necessarily in our schools, but what I want us to acknowledge and at least have conversations about through our data team is sometimes the instruction isn't right. It isn't appropriate. It isn't matched to what the students needs, or going back to a lot of conversations that we have about high quality instructional materials, instructional coherence. Did the teacher do the intervention with fidelity to a manner that it was intended to be done? But did they also say, or were they too, this was a good conversation we had yesterday at our Dyslexia Advisory Council. Was the approach to instruction and intervention so stringent that we weren't able to be responsive to the child's needs? Were we so boxed in with our scripted materials that now we knew we should have shifted and pivoted, but we didn't because we knew that we had to approach it in this manner? Folks, these are the conversations we have to have with our folks. We know that we have a very young generation of teachers that are coming out of our higher education programs. They may not have the same skill set that some of our more veteran teachers and interventionists have. What are we doing to equip them, whether that's engaging them through trainings that potentially Dr. Dainty and Dr. Richardson are doing around ensuring that they understand their obligations around intervention and instruction for reading in other areas, but what can we also do to help highlight and equip them? and asking those good questions. If you have never seen our SLD training, I'll drop it into the chat at the end. This is just good protocols to say, what skill were you teaching? What data were you collecting to show that the child was making progress or lack thereof? Do they understand the grade level standards that may have been missed in tier 1 and what they're doing to remediate on those? And then what is their skills-based approach that they're utilizing to build those competency and those skills for those students to be able to access general education? So again, I feel like we're speaking to the choir. I see all these familiar names. I see some people saying that they agree in the chat. I appreciate that. Because I think as assessment specialists, oftentimes you are put into situations where you're having to combat the instruction or intervention. And I don't feel like that's our role, but I also want to equip you to have the knowledgeable conversations if you need to have those at the district level, right? So are we communicating? We've talked about this, folks. Are we communicating? What is that communication? Are we sending home regular reports with our students who are in tiered intervention? And is there an opportunity for our parents to ask us questions about that, right? Do we have some time to engage with parents, whether that's just at the parent-teacher conferences that I know that we all hold, but is there an opportunity for parents to say, well, what does this really mean in light of where my child is compared to same age peers? And really being able to articulate your position. And I think that the more transparency and communication you have with parents, the less likely that it's going to end up in any level of dispute resolution. I certainly know that there's conversations and there's parents that may not be amenable to what you're doing, but please know that your schools and your teachers are still the instructional experts. And even in light of what I just mentioned, that there could be a mismatch, they are still the instructional experts. They have trained to teach, trained to intervene. And we need to acknowledge, too, that sometimes the positions that our parents and advocates take is one of, my child is different than all of the other students. And we know that when we talk about suspecting a disability, that holds gravity and that holds weight. And we need to have the data to justify in communicating with parents why we're either refusing to propose an evaluation or we're moving forward with that. Recognizing some next steps. We've talked about this, folks. I'm not going to belabor this point. Let me dig into this case here. Other than, I think this is probably more so should have been, now that I'm saying this out loud, should have wrapped us up at the end. But are you creating guides for your teachers to know what developmental milestones look across grade level, across language, across behavior, across academics? Do they know what to expect? And when they see something that maybe is awry, what those referral practices are, right? Maybe considering hosting a developmental snapshot across developmental domains at a faculty meeting or at an in-service. This is going to ensure that you're getting good referrals, right? And I say good referral, I usually put it in quotes because in the almost 5 years I've been at the department now, the work that I've done across the state and districts, goodness, I can quantify that there are a lot of bad referrals, and you are then tasked with evaluating a bad referral. And we know that there are district policies and procedures that may mandate that we assess every referral. But goodness, if you get a referral that you have very limited information about and you're approaching, I quantify it to approaching the case blind, we already are at a disadvantage. And if we're at a disadvantage in that case, I think it sets us up procedurally for a dispute resolution because it's not a good referral. And we knew it wasn't a good referral on the front end. And we didn't suspect a disability, and we procedurally maybe chose not to refuse that evaluation. And we didn't do that formally through a prior written notice. So ensuring that, are we teaching our faculty to submit good referrals, and what do your district policies require them to submit? Maybe they're going to show us that they've had communication with parents about their concerns. Maybe they're going to have to submit multiple work samples that are redacted to show us why the child's not meeting those grade level standards. Maybe they're submitting multiple end of unit formative assessments to our teams to review as we're considering if evaluation is appropriate. If they're just coming and saying, well, they scored at the 12th percentile on our benchmark screener, I think we need to refer because they have a processing issue. Folks, it's a bad referral. We don't have the information we need in order to justify that we suspect a disability. Are we teaching and consulting around classroom management? Folks, if you have heard me speak about behavior, you know, and as a previous teacher, classroom management is not a required course for any of our pre-service teachers. It is an elective that they can take. It's not required. And so we think that teachers come out of their programs and they just understand how to organize not only instruction in a meaningful way, engage learners in a meaningful way, but then organize and set up classroom structures and routines that make sense and is in the best interest of students. Folks, that's a lot of guesses there that we know that they have those skills. Are we teaching and equipping them? And if we don't have the skills and knowledge to do that, are we connecting them to, whether that's connecting them to our technical assistance network, Tennessee Support Center, where we can do a district-wide approach to classroom management and tiered approach to behavior? Are we equipping them to do tier 2 interventions that are not just check in and check out, right? Do we have a toolkit that we can hand over to our teachers and our data teams and say, here's what we can do that is empirically based, that really is going to move the marker on student outcomes? This is where your roles really push in. And this also applies to language, right? Our speech language pathologists that are on the call. Are you doing the same things for our students? How many times are you getting those referrals, getting stopped in the hallway saying, well, Johnny, he has a speech issue, or he has also a language issue. He's not processing. Come listen to him or come observe. Folks, your pre-referral processes should be strong enough that we're not stopping our assessment specialists in the hallway. They should know how to make those referrals, okay? And then also thinking through that oral language foundation to literacy development and knowing those prerequisite skills that are required for literacy development, and do our teachers understand the underpinnings of what those are in order to, again, create those tier 1 whole class interventions as necessary, or instructional approaches that are in the best interest of all of our students, right? And then also ensuring that those referrals that you get are justifiable and quote unquote are good referrals. Let's look at this kindergarten situation here. Okay, this is where I'm going to quiz you a bit. So everybody be ready to type in the chat. So kindergarten teacher has 14 students. Yeah, right. We know they have a lot more than that, right? Each student arrives at school with varying levels of abilities. We all know that. Some had preschool. Some were at home with their moms all day. Some had a Head Start. Some had nothing. Some had a daycare center. They all come with unique backgrounds. The grade level, the kindergarten teacher has grade level standards to ensure the students achieve by the end of the kindergarten year. She knows what she's starting with. She has a scope of sequence. She knows which lesson she's starting with first. She knows which sounds they're going to be targeting initially when we talk about having them master those print and sound concepts. She knows what she's doing. My question is, do you? If you get a referral from this kindergarten teacher for one of these 14 students, and she says, this child is not meeting the markers of grade level standards. First question to you is, do you know where to go to find grade level standards? Do you know what those are for across the content and academic domains for a kindergarten student? And if you don't, if you're like, I've never had to look at those, that's a problem, folks. That's a problem, because how do you ask the right questions when you're doing this pre-referral process if we don't know what those grade level standards are, okay? Because this is where it is the conversation around instructional relevance, right? Is the teacher exceeding the scope? Are we talking about skills or standards that may be approached at a higher grade level, right? And is this reasonable? Is this reasonable for what we're asking this student to achieve and to do based on the scope and sequence at the same level? I know a lot of when I entered kindergarten, folks, the difference in what we expect from our kindergarten students from 80s to now is unheard of, right? Is that reasonable in light of what we're asking those students to do in context of what they had coming into that setting, right? Because it is going to matter and it is going to be dependent on level of access prior as well. So let's look at this. First question in the chat. This is a kindergarten Tennessee grade level standard. So I'm gonna let you read that for a moment. The first question I have for you is, who knows what the acronym K period FL period PA period 2 means? Does anybody know? Don't feel like you have to unmute. Feel free to drop it into chat. Love it. Several of you know. Kindergarten, foundational literacy is the FL. I see some phonological awareness. I see some phonemic awareness. Oops. Making sure that we understand what these look like. So if you Google, even if you just Google it, assessment specialist, you'll understand foundational literacy, right? And you'll be able to find the standards that you're looking for, whether that's print concepts or that is your phonological phonemic awareness. Our obligation is, if this teacher comes to us and says this child is not able to isolate and pronounce initial, medial, or final phonemes, you have to know what that means. And you have to be able to speak to the data that you may need to collect to measure that they can't do that. So then the next question I have for you folks is, give me an assessment, whether it's speech language or under academics or reading for us school psychologists, that you would administer to dig deeper into this standard. I see a lot of C-top. I see a Wyatt. I see a, ooh, my thing's going nuts. See a KTA, a Wyatt, KTA, phonological processing. Could you also do some informal measures? Maybe we're going to do a informal reading inventory that's going to focus on this skill, right? Absolutely. It doesn't just have to be I see a PASS, a POWERS, DRA. Absolutely. Any of these could help glean into this. Now, that data piece alone, is that going to make or break if this child qualifies? No, but now we have some good justification to say, okay, based on the teacher's report, based on the benchmark level screener, based on their progress monitoring of this skill, based on the intervention and getting this skill remediated, based on my achievement test and my reading assessments and my language assessments. Now we're starting to build out a profile to understand why, the underpinnings of why this child is not able to achieve grade level standards. So let's keep going here. What are some foundational skills, throw it into chat, that a student must know in order to be successful with this standard? Throw it into chat if you have some ideas. What must they be able to do in order to isolate, pronounce initial, medial, final phonemes and 2-3 phoneme VC, CVC words? I see letter sounds, letter sound identification, segmentation, blending, absolutely. Academic vocabulary. Yes, I love that you said that, Dr. Dainty. What does first, medial, final mean? Does the student need to know that? I hope we're teaching that. Love it. Love it. So let's look through there. Some auditory discrimination, essentially what you're talking about, being able to discriminate sounds, understanding what those sound like in practice, seeing the difference between those in print and in spoken word, clear articulation. Is it clear? Can we understand what they're saying? Because if there is some level of speech issues, that's going to impact their ability to discriminate those consonants and those vowels. Also, my school psychologist, isn't there a level of working memory and critical foundation skills that are important when we're thinking about reading? Yes, all of these skills are at play when we think about this one kindergarten standard, folks, one kindergarten standard. And so when we think about our data collection, do we have data to help support some of these areas for auditory discrimination? Do we know that they have a clear articulation of consonants and vowels? Do we have data to show their level of working memory? And if we don't, do we know that they have the prerequisite skills to achieve that grade level standard? And as you're collecting that data through your evaluative process, this is going to help drive your decisions around what specially designed instruction looks like, right? Because now we know if they don't have a clear articulation of consonants and vowels, now we know here's our PLAFT, here's our service of that specially designed instruction, and this is what it's going to look like in order to provide this child access in that grade level classroom, right? Julie, I'm gonna keep talking because I don't remember when I'm supposed to stop. So I just set myself up perfectly for specially designed instruction. Anybody want to take a stab in the chat? What and how does IDA define specially designed instruction? Specially designed instruction is special education, folks. It is special education. But what does it mean? When we say that a child requires specially designed instruction, right, versus or in addition to tiered supports, what does that mean? Anybody know what it means in the chat? Patty said tailor to a specific student. Okay. Yes, it must be individualized for that child to make progress in light of their unique circumstances. So what does specially designed instruction, how is it defined under IDA? I see modifications, difference in content, methodology, presentation, Lynn, gold star. Specially designed instruction as defined. This is defined in federal law. This is what your IEP is doing. Can I also say that specially designed instruction does not replace Tier 1 instruction? It is the vehicle, specially designed instruction is the vehicle in order for your students to access Tier 1 grade level instruction. And it is defined as adapting as appropriate based on the needs of the student, as somebody said, tailored to that individual student, the content, methodology, or delivery of instruction. This is what the vehicle of your IEP does. But how many times are we in that tiered process? Are our students who are going through the tiered intervention, do we feel like, ooh, we are starting to provide specially designed instruction through tiered intervention? And if we're starting to lean to that side of things, we need to make a referral, right? Look for those signs of specially designed instruction instead of tiered intervention. Duration, are they staying in that hamster wheel of tiered support for year after year after year? The depths of support. And when we think about the depths of support, when we think about providing that tiered intervention to them, right? And as they are making progress or not making progress, and we're having to adjust for some of that, folks, that depth of support, if we're also starting to say, going back to the general education teacher, hey, this would really benefit them to have some additional accommodations, modifications in the classroom, we're going to have to really slow down the level of instruction. We're going to have to do a level of reteaching with this child at the end and conclusion of every lesson. When we're starting to individualize those and go into greater depth, now we can start to get our toes in the water, specially designed instruction. And that should be your flag that we need to evaluate our students and ensure that we're not, again, delaying and denying because we're providing tiered intervention, unless you can really justify, going back to that case law, that the student is making really good progress and is closing that gap and within a reasonable time frame, and you can justify why staying in that tiered intervention is what's most appropriate for that child. So let's look at a couple of different cases. We actually have some that are local to us. Not this one. I think the next two are local to us, maybe. Kindergarten student was in tier 1 and 2 interventions for 7 consecutive months. Student went to first grade, was moved to tier 3 for 9 consecutive months. The LEA had a policy of referring to special education after 8 weeks of unsuccessful tier 3 intervention. Eventually, the LEA completed an IDA evaluation, developed an IEP with only 3 days of the child's first grade year left before summer. Parent filed due process indicating a child find violation. What do you think? Did the district violate child find here? Don't see any guesses in the chat. Yes, yet. Just gave the answer away. Yes. Their district policy said that they were going to refer after 8 weeks, and they didn't even do that, right? Make sure that if you have a policy procedure in place that says you're going to refer if they're not making adequate progress, which I would caution you to even have that in writing, to be honest with you, then you're going to follow what that policy and procedure stated. So making sure that if you do have it in writing, you're following it, but we're not delaying, denying. And in this case, this child was just sitting in that hamster wheel of RTI. This was one of our local cases. A preschool age student was evaluated under IDA and state guidelines by the Tennessee LEA for suspected speech and motor concerns and was found to be not eligible for special education services. Less than a year later, the student enrolled in kindergarten. The parent then requested another IDA evaluation. The LEA refused the request and instead implemented general education supports. The LEA later completed an evaluation for 504. The student was eligible and they developed a 504 plan. The parent filed suit indicating child find violation. What do you think? How do you think and who do you think prevailed in this case? Maybe just another minute to respond. If you're brave enough. This case was really interesting because this was out of Williamson County, and the district court said that they did not violate child find because they refused subsequent evaluations. They did evaluate, and the child was not eligible. And then they considered the need for a 504 plan. And even though this parent then appealed that finding, the Sixth Circuit upheld the ruling that the district did what they needed to do. So kudos to Williamson County. The parent failed to show that the LEA did not consider all areas of suspected disability. And just because a parent refers doesn't automatically mean that there is a suspicion of a disability by the LEA. And the LEA proceeded in the perfect way here. They responded as they were supposed to. They did consider the need for a 504. And we know that I think this case would have been different is if the parent, when they referred in preschool, they maybe declined that evaluation, but they didn't. They assessed, and they assessed in all areas of concern that were flagged for them. That is what our obligation is, right? It's not that we have to evaluate every single time a parent comes to us. We must consider that request and document it in a prior written notice if we're going to agree and propose that evaluation or refuse that. Let's look at one other case. This one was out of Wilson County. This was in 2023. An 8th grade student recently moved to the Tennessee LEA from another state. Student showed behavioral concerns of being non-compliant and disrespectful. The LEA noted that he had recently moved to a new school in a new state, and his behavior was not that different from same grade peers. The LEA decided to try behavioral interventions first before evaluating under IDA. The parent indicated a child find violation. What do you think? How do you think the courts ruled here? Any guesses? district would prevail. The Sixth Circuit Appeals indicated the LEA had no reason to suspect a disability given that the child entered their LEA from another public school district in another state and was not identified as a child with a disability. And the court upheld and said, yeah, the use of behavioral interventions is great. They did identify within it that they did need to be implemented with fidelity. I think there was some question from the parent and that says that they weren't being implemented with fidelity, but they were implementing behavioral interventions. And then they also took into consideration the testimony from school staff saying that the child's behaviors were not as severe or disruptive compared to other students. And I guarantee folks that they probably had some good data to justify that the child's behaviors were not so significantly different compared to other grade level peers. That's the important piece of this is we're going to consider their referral. We can refuse that through a prior written notice. We can implement tiered interventions as appropriate for academics or behavior. And then we're going to document and share the data with the parents, right? We're going to share that with the parents. And then ensuring that we're implementing with fidelity. Dr. Dainty, can I call you out for a second? I don't know if you're available to come on. Yesterday, you had a great at the Dyslexia Advisory Council, you had a great position on implementing with fidelity, but also you expounded on that a little bit. And I loved your position. Do you mind sharing that with this group?
Yeah. We talked about the importance of implementing with fidelity, but also with integrity, meaning that yes, we are doing the program as it was designed to be done. Yes, we are, following whatever the scope and sequence of that is, but also that we are responding to our student needs in real time and making adjustments as needed to ensure that that instruction is hitting the needs of the student. So do you want me to go further than that, or is that?
That's perfect. I just think, and I have never framed it that way, but thinking about we talk a lot about fidelity when we get to the evaluations for students. Was instruction and intervention implemented with fidelity? But go further than that. Was it also implemented with integrity, knowing that this is someone's child on the back end of this, and we were making good database decisions for this child in light of what we knew? And that fidelity with integrity is always going to be the most legally defensible position you can have, right? Always. And so I love that she said that yesterday. And as I drove home, I just mulled it over and chewed it over because I love that. I feel like we need to put that on a placard in all of our offices. It's not just fidelity, it's fidelity with integrity. Julie, I'll pass it back over to you.
I'm sorry, I was having trouble getting unmuted. Okay, frequently asked questions. These are some questions that we are getting from you guys out in districts. And so we wanted to just take a moment to talk about these while we had all of you gathered as a group. Is a child with a disability who is receiving special education and related services eligible to receive RTI services? They are. There's nothing in state or federal law that prohibits a student with a disability, a student with an IEP, from also receiving RTI services. And so April, a little earlier, she mentioned specially designed instruction versus or in addition to tiered interventions. So students who do have an IEP can also receive services through RTI. So that bottom one there, a student who is receiving special education services should not be excluded from tiered interventions. And this applies to all students with all eligibility. So not just talking about specific learning disabilities, but you could have a student who is other health impaired and requires some services along the lines of executive functioning in the classroom, but may also need tiered support in math or reading. And there is nothing that prohibits that. Another one that we receive often is, can a student who is eligible under SLD and reading fluency also receive IEP services in math? And so before we go through this one, I want you guys to see that result from is underlined. And so that is how you are making that connection. Goals and services should reflect the needs of the child that result from the disability, but those needs may or may not be directly tied to the eligibility areas. So what we are saying there is that a student could have SLD and reading fluency. And if the team determines that their math difficulties result from their disability, they could receive services in that area. And then what is down below that is just where that comes directly from IDEA, a statement of measurable annual goals, including academic and functional goals directly designed to meet this child's needs that result from the child's disability, to enable the child to be involved in and make progress in the general education curriculum, and meet each of the child's other educational needs that result from the child's disability. April, do you have anything you want to add there?
I do. Folks, we probably get this question 5 times a week. And oftentimes we're always going to write back the same blanketed information that you see here. Ultimately, services are a team decision based on current and valid data. So if there is a child with a, language impairment and the team wants to add reading services, the team has the authority to do that. What we will always encourage you is that you should be evaluating in all areas of suspected disability. We're not just going to throw everything but the kitchen sink in services, right? We see that often when we're going around looking, especially for our folks that are disproportionately identifying students with disabilities. We pick up those IEPs. Every single kid has, twice a week for 30 minutes speech language. Every single kid has 5 times a week for 45 minutes of reading intervention. When we start to see IEPs that look the same, that tells me that we're not actually meeting the child's needs that result from the child's disability. We are blanketing that this child, because they have SLD, every kid with SLD gets this. Every kid with language impairment gets this. We serve students, we don't serve eligibility categories, but your obligation still under state and federal law is to evaluate in all areas of suspected disability, even if they're not commonly linked to that eligibility category, okay? And so if you message us and you say, hey, this child is other health impairment or their speech language impairment or their SLD in reading, we want to add math, I'm going to probably cite you back this. Does the child's needs result from the child's disability in math? And are you able to serve them in that area? The team always has the discretion to do that, but it will always be in your best interest to, instead of just throwing specially designed instruction at students, remember, it's not replacing Tier 1 instruction. That's not what an IEP is doing. It is a vehicle for you to give access to your child or to your students to Tier 1 instruction. And that means that we can adapt the content, methodology of delivery, instruction in order to give access to. That doesn't mean that they just get to leave math every day and go to the resource room and get math there. If that is the process that's happening, folks, we're doing it wrong. We're doing it wrong, okay? The IEP and those services do not replace Tier 1 supports and instruction. Yes, I will give you the same blanket information. If you would like to have that email, we'll certainly able to give that to you. Before we go to any closing thoughts here, Dr. Dainty, Dr. Richardson, any final thoughts about the content today? Anything else? I will ask that folks please attend Dr. Dainty and Dr. Richardson's trainings. If you've never been through any of their formal dyslexia trainings, any of that, that's going to be such a great resource for you. Hopefully, you're connected with all of the initiatives and communities of practice that they do. But any final thoughts, Dr. Dainty, Dr. Richardson, before we close out today?
I don't have anything. I think it was a great discussion, lots of good information. I'll drop my email into the chat for those who aren't familiar with me. And if you do want to reach out about anything, I'm happy to follow up.
I don't have any additional. I appreciate the conversation that came out of today's presentation and just want to remind everyone that the purpose of, as Dr. Ebbinger did state, response to instruction and intervention is to respond in time with the need and to identify the need. So we're not limited to a single, if you will, linear response to that. And we just need to acknowledge what our students need and respond appropriately in time with that need. I will also drop my contact information for those who may need it.
Perfect. I'm going to stop the recording.